Well, hello everyone. I am Marcia Littlejohn, and I am here at New Vision Eye Center with Dr. David O'Brien. And you know, when you say Dr. David O'Brien, everything turns just absolutely magnificent. How are you doing?
Hi, Marcia. I'm doing great. Nice to see you.
Well, it's wonderful to see you, and of course to learn so much more about New Vision Eye Center and what you're doing and how we have come such a long way and so many advancements and various things that are going on. But I thought it would be fun to let all of our individuals who are learning a little bit more about New Vision Eye Center learn a little bit about you as well and a little backstory. Because when we think of you, we think, of course, of so many different surgical processes here at New Vision.
Right.
Tell me what your specialty is, Dr. O'Brien.
Well, I was trained in cornea and refractive surgery. So what that means is that dealing with dry eye and irritations of the eye and abnormalities of the surface of the eye, as well as the outside of the eyelids, and also correcting vision using lasers to get rid of or reduce the need for glasses and contact lenses. So I've really enjoyed that, and it's come a long way since I've trained. I finished my training in St. Vincent's in New York, and then in Oklahoma City in 1995. So I've been here 20 years now.
Oh my golly, it doesn't seem that possible that it could be that long. But you've done so many miraculous things here too, though, because I think when, Dr. O'Brien, when we see people that have had some of your procedures and they are so pleased and so happy, and you and I have spoken for years, and I've always said people come from all over the country to New Vision Eye Center now, and of course to really follow you all around. But if you were to say you have specialties,
right,
but you also keep up with all of the physicians here and all of the ophthalmologists at New Vision keep up with every single new venture, don't they, in eye care?
Ophthalmologists are very commonly kind of entrepreneurial, but also we like gadgets. We like lasers, we like the most advanced technology available, and I enjoy that. I like technology, and it has allowed us to provide better, safer care with, you know, as far as removal of cataract, excuse me, correction of vision with lasers to allow decreased dependence on glasses and contacts, which I've had done, and I tell you, it changed my life.
Well, what are the newest inventions, I should say, and what you have been working with over the years?
Well, we were one of the original investigators for a laser called the wave-light laser, which was a laser that was specific for correction of astigmatism during LASIK and PRK, and we've been really, really pleased with that. We were also one of the first practices to be doing correction for farsightedness or hyperopia, which I also had done. So I had both of those procedures done myself almost 18 years ago.
Really?
And so I've had fantastic results, and I can still pass a driver's test and, you know, at the DMV and ride my bike and work out and do things without glasses on, and it's a blessing. I'm
well,
really
you know, there's
pleased.
nothing greater than to know that you're dealing with a doctor who's been there, done that, so to speak, because you have had almost done it all, haven't you? But when we think about some of the wonderful advancements, as you say, is there anything that the world of ophthalmology is lacking, what we're still looking for? Because I think of, you know, at my age and with the friends of mine that everybody says if you live long enough, you're going to get cataracts. You can have macular degeneration. You have, what is the other, glaucoma.
Sure.
Is that just an absolute for individuals?
No. All those conditions are treatable on some level. Macular degeneration is probably the last frontier, as is the loss of near vision due to aging. We still have not conquered the capability to correct distance vision and near vision at the same time, unless we do what's called monovision, where we correct one eye, the dominant eye, for distance, and the non-dominant eye for near, which again I've had done. But you know, to be
nobody
able to
can get away with anything around you, can they?
Right.
You can see them coming and going.
But to have simultaneous vision in both eyes, that we're not quite there yet. Now, with lens implants during cataract surgery, there are multifocal lens implants available, and for some patients, they work extremely well. But what we have not yet been able to conquer is the ability to actually have excellent distance vision and the capability to focus as we do when we're in our 20s, for distance and near at the same time. In other words, to have a range of vision, actively focusing. And that's something that is in development, but is not yet available. But what we do is we typically try to talk with patients about what their needs are and offer them the best option available for them, with safety, obviously. And we were the first practice in the area to use lasers to remove cataracts, which absolutely is an advance to allow safety as well as reproducibility. And that same laser can also be used to make the flap when we create LASIK flaps to do laser vision correction. So.
Well, I think this is one of the things about New Vision Eye Center, Dr. O'Brien, is that we've always believed with Dr. Minotti and his team, of all of you physicians, you keep up with every single one of the newest and greatest and best inventions. And it just seems to me that the progression is what we're all so proud of with New Vision. And now, of course, you have a staff here of wonderful individuals that are working along with you, and a team effect here at New Vision. But I guess really, I want to get you back sometime and really talk about how important is the brain in seeing out of one eye versus the other eye. Because from what I understand, that's where the situation is that your brain has to get ready for near vision or far vision.
Absolutely. There's a definite patient selection process for certain procedures that we do, and that involves a careful discussion beforehand, and that's what we excel in. This practice is known for that. We like to spend time with patients, and we like to really educate them about their options, and that allows for a better relationship and the patient to have a level of comfort. So, because let's face it, you know, having a surgery is something that provokes anxiety. You know, we've all had procedures that, you know, they make you
uncomfortable. I have to say, I think everybody who has even stepped in that door of New Vision Eye Center has the confidence that you guys, every single one of you, every one of the physicians here and the entire staff here at New Vision know exactly what they're doing and keep up with everything. And I love that communication back and forth too. As you say, that's just vital.
It's key.
Absolutely. Well, it's wonderful talking to you again, and of course, love to keep up with you and get back and really talk about some of the other situations in ophthalmology at New Vision Eye Center. Thanks for being with us.
Thanks, Marcia.
And thanks for watching.